ABCs of diabetes, Sherry Bezeski, RN, APNC. Disclosure statement. Healthcare Associates of NJ is an LLC which is owned and operated by Sherry Bezeski, RN, APNC. The information contained within this document is based on the most recent clinical guidelines I could find using evidence-based research tools and does not replace your primary healthcare provider's judgment or other specialty care provider's judgment, such as an endocrinologist or a cardiologist, etc. The information should be used for you to gain knowledge regarding diabetes and cardiovascular health related to diabetes. Specific questions about your care must be addressed to your healthcare provider. Explain how hemoglobin A1C affects your diabetes care. State in one's own words what systolic and diastolic blood pressure mean related to your body. State what blood pressure goals are for older adults, age greater than 60, with diabetes who are relatively healthy according to J&C 8. Explain what the target blood cholesterol for diabetic people usually is according to Joslin Diabetes Guidelines. Explain how heart failure patients and other cardiac patients with diabetes might be affected by hypoglycemia and hyperglycemia. How does high blood sugar affect your arteries? Understand how hypoglycemia affects your cardiovascular system and can lead to cardiovascular events such as heart attack. Understand the warning signs of hypoglycemia. Understand how protein found in the urine can affect the kidneys. Understand how certain lab values such as hemoglobin A1C and cholesterol levels affect your health. ABCs of diabetes, hemoglobin A1C. B. Blood pressure. C. Cholesterol. A in ABC's hemoglobin A1C. Glycated hemoglobin A1C is a protein that carries oxygen around the body and drops it off where needed. Glucose, sugar binds to the protein hemoglobin A1C. Hemoglobin is a red blood cell that lives in the body for 6 to 12 weeks. A in ABCs of hemoglobin A1C. The more glucose in your blood, the higher your hemoglobin A1C is. The goal for hemoglobin A1C is less than 7% for most young, healthy people with diabetes. Fasting blood sugar and self-monitoring finger stick of 70 to 130 milligrams per deciliter for relatively healthy young diabetics. A equals hemoglobin A1C for healthy young adults, ABCs of diabetes. Bedtime blood sugar, self-monitoring blood glucose of 110 to 150 milligrams per deciliter. 2-hour postprandial self-monitoring blood glucose should be no more than 180 milligrams per deciliter. Diseases related to poor blood sugar control are stroke, heart disease, peripheral vascular disease, such as limb pain and limb loss, kidney disease, eye disease, and nerve disease. A equals hemoglobin A1C for older adults. Healthy older adults' hemoglobin A1C should be less than 7.5%. This is equal to a fasting blood sugar of 80 to 130 milligrams per deciliter. The bedtime blood sugar of 90 to 150 milligrams per deciliter is appropriate for older adults, according to Joslin Diabetes Center. 2-hour postprandial should be less than 180 to 200 milligrams per deciliter. A. Hemoglobin A1C for older adults with 2 or more chronic illnesses, ABCs of diabetes. Older adults with 2 or more chronic health conditions have a higher incidence of hypoglycemia and a high risk for falls. Hemoglobin A1C goals less than 8%. Fasting blood sugar of 90 to 150 milligrams per deciliter is appropriate for older adults with 2 or more chronic conditions. Older people with very poor health, such as end-stage chronic disease, hemoglobin A1C should be less than 8.5%, with a fasting blood sugar of 100 to 180 milligrams per deciliter. a bedtime blood sugar of 110 to 200 milligrams per deciliter. So there's no hypoglycemia during their sleep. 2-hour postprandial self-monitoring blood sugar should be less than 200 milligrams per deciliter. Ask your healthcare provider for your specific guidelines. Such things as wounds may change the blood sugar goals, but you must be evaluated by your healthcare provider for your appropriate goals. Heart failure and diabetes. With each 1% increase in hemoglobin A1C, you have an 8% increase in the chances of getting heart failure. With hemoglobin A1C of 10%, you have a much greater chance of getting heart failure. Higher hemoglobin A1C and higher blood sugar increases the thickness of your blood and increases your heart failure rates. Heart failure and diabetes. People with heart failure have 2 times the chance in men and 5 times the chance in women to have hyperglycemia and diabetes. Hemoglobin A1C and self-monitoring blood glucose goals for older adults. Hemoglobin A1C targets below 7% and 6.5% can cause cardiac problems and falls in the elderly due to hypoglycemia. Hemoglobin A1C goals of 7.5 to 8% is the goal for patients at risk for cardiac events, and falls. Hemoglobin A1C goals and self-monitoring blood glucose for older adults. The rate of heart disease is higher than average in older people with diabetes. The tighter the blood sugar and hemoglobin A1C goals has been related to low blood sugar or hypoglycemia, and you have a higher incidence of heart attack, heart rhythm irregularities, and falls. Hemoglobin A1C levels associated with self-monitoring blood glucose. Hemoglobin A1C of 5% and a self-monitoring blood glucose of 101 milligrams per deciliter, and a blood glucose of 5.6 millimoles per liter. A hemoglobin A1C of 6.5% is a self-monitoring blood glucose of 154 milligrams per deciliter, and a blood glucose of 8.8 millimoles per liter. A hemoglobin A1C of 7% is a self-monitoring blood glucose of 172 milligrams per deciliter and a blood glucose of 9.6 millimoles per liter. Hemoglobin A1C at 10% is a self-monitoring blood glucose of 279 milligrams per deciliter and a blood glucose of 15.6 millimoles per liter. Self-monitoring blood glucose is a method of testing a blood sample for blood glucose levels at home. Self-monitoring blood glucose testing can keep blood sugar levels closer to normal. If you have diabetes, you should be checking your blood sugar using a blood sugar monitor. Self-monitoring of blood glucose. A blood sugar monitor is a small device, also called a glucose meter. Self-monitoring blood glucose for older adults, according to Joslin Diabetes Center. Mean glucose should be 150 to 160 milligrams per deciliter. Pre-meal blood glucose should be less than 130 milligrams per deciliter. Postprandial blood glucose should be less than 180 milligrams per deciliter. Diabetes diagnosis facts. Hemoglobin A1C equals 6.5% or more. Fasting blood glucose of 126 milligrams per deciliter. Fasting is defined as no caloric intake for 8 to 12 hours. Diabetes diagnosis facts. Random blood sugar greater than 200 milligrams per deciliter with large symptoms of large amounts of urine, thirst, unexplained weight loss, and ketones in the urine. Oral glucose tolerance test. After taking 75 grams intake of glucose, your blood sugar should be less than 200 milligrams per deciliter after 2 hours. Hypoglycemia is a condition which can happen with type 2 diabetes if the patient is using insulin or other oral medications. Signs of hypoglycemia are confusion, hunger, lightheadedness, shakiness, sweatiness, drowsiness, dizziness, sleepiness, palpitations, headache, anxiety, tremor, and blurred vision. Hypoglycemia can lead to death and coma if severe enough and left untreated. For instructions how to administer glucagon, injection instructions can be found at http://www.lilyglucagon.com/. Self-monitoring blood glucose, such as from a venipuncture, blood glucose levels should not be greater than 200 milligrams per deciliter. If they are greater than 200 milligrams per deciliter, you need to adjust your diet and/or medications and ask a health professional for help. Prolonged hyperglycemia can cause clogged arteries, which could affect your heart and could cause loss of limb. Blood pressure and diabetes. Factors that affect hypertension and diabetes are increased age, increased weight, race, insulin resistance, and decreased response to insulin. If you have high blood pressure and diabetes, it can lead to heart disease such as heart attack and heart failure, stroke, and kidney failure. Blood pressure is the amount of force exerted on vessels or pipes that carry blood throughout the body. Blood pressure has two components, systolic and diastolic. ABCs of diabetes. Blood pressure, or BP. Systolic BP is the amount of force exerted on the vessels when the heart squeezes. Diastolic blood pressure is the amount of force exerted on the body when the heart relaxes. Blood pressure is measured in millimeters of mercury, abbreviated mmHg. Hg is the symbol on the periodic table for mercury. Blood pressure. The goal for adult people younger than 60 years old is less than 140/90 millimeters of mercury. People older than 60 years of age, the goal is less than 150/90 millimeters of mercury. Blood pressure goal for age 60 years or older according to J&C 8. If your blood pressure is lower than 150 systolic and 90 diastolic, then there is a decreased chance of stroke, heart failure, heart attack, and coronary heart disease. Blood pressure goals for older people according to J&C 8. People 30 to 59 years of age should have a blood pressure goal below 140/90 millimeters of mercury. Blood pressure goals for older adults according to J&C 8. People older than 60 years old should have a blood pressure goal below 150/90 millimeters of mercury. Your healthcare provider and you will decide your own goals according to your specific medical needs and lifestyle. People with chronic kidney disease or people with diabetes aged 30 to 59. Blood pressure should be less than 140 millimeters of mercury systolic and less than 90 millimeters of mercury diastolic. Your healthcare provider will determine your blood pressure goal according to your own health needs. Hypertension and microalbuminuria, protein in your urine. High blood pressure can lead to microalbuminuria, protein in your urine. Microalbuminuria is the earliest sign that kidney damage is occurring due to high levels of blood glucose. Self-test for proteinuria. You could buy urine strips at www.meditest.com and order urinalysis reagent strips 10. These strips test for ketones, glucose, protein, and other urinary problems, or you could buy them at your local grocery store or pharmacy, or ask your physician where you could buy urine strips. Results should be referenced and shared with a healthcare professional for follow-up and interpretation. Diabetes and ketones in the urine. Ketones are produced when fat is burned. In diabetes, this is because glucose is high in the urine stream and does not enter the cells of the body to be used as fuel. Hyperglycemia makes blood thick and clogs the arteries. Ketones are not in the blood until blood glucose sugar levels are above 250 milligrams per deciliter. You can test for ketones using urine strips, especially good for 6 days when glucose is high. Hypertension and microalbuminuria. Most healthcare providers check the kidney function doing a test yearly called GFR, or glomerular filtration rate, and it should be greater than 60 mLs per minute. Blood pressure goals for people with kidney disease. For people with a GFR less than 60 millimeters per minute with proteinuria, the BP goal recommended is less than 130/80 millimeters of mercury. Your healthcare provider will determine your BP goals according to your own health needs. Hypertension and microalbuminuria, protein in the urine. If your GFR is less than 60 millimeters per minute, your healthcare provider will discuss treatments such as medications that decrease chances of renal failure. ACE or ARB inhibitors will help with high blood pressure and prevention of kidney problems. Information on kidney disease from the NIH. For more information about kidney disease, you could go to the NIH website at https://www.nih.gov/health-information/programs/NKDEP/learn/causes kidney disease testing understand GFR pages with a capital P understand GFR.aspx. High blood pressure and diabetes. Treatment of high blood pressure affects diabetes outcomes and reduces stroke and heart disease. C is for cholesterol. Cholesterol is a fat which makes vitamins and other useful products for the body. It also blocks arteries and prevents blood flow to the heart and other body parts. Cholesterol is a fat called a sterol. Cholesterol produces testosterone, estrogen, and vitamin D. Cholesterol is manufactured in the cells and comes from food. Types of cholesterol are very low density lipoproteins, VLDL, LDL, low density lipoproteins, HDL, high density lipoproteins, which is the good cholesterol, and triglycerides, the fat particles from proteins. LDL, or low density lipoprotein goal, is less than 100 milligrams per deciliter. Triglycerides is less than 150 milligrams per deciliter. High density lipoproteins, or good cholesterol, is greater than 40 milligrams per deciliter for men and greater than 50 milligrams per deciliter for women. Fat facts. Your brain is 60% fat. Fat makes up nerve cells. Fat makes up pieces of your hormones. 3 types of fat: saturated, monosaturated, and polyunsaturated. So it's saturated, monounsaturated, and polyunsaturated are the 3 types of fats. A diet high in saturated fats raises cholesterol, and a diet low in saturated fats lowers cholesterol. Trans fat is an unsaturated fat which is hydrogenated, such as margarine, which turns oil into corn oil into margarine. Trans fat raises low density lipoproteins and lowers high density lipoproteins, and this is found in most processed food. Fats. Saturated fats includes butter, meats, cheeses, lard, and coconut oil. Monosaturated fats are olive oil, almonds and peanuts, canola oil, avocado, and sesame seeds. Polyunsaturated fats are soybean oil, walnuts, corn oil, salmon, and flaxseed. Diabetes and cholesterol. People with diabetes have heart attacks at a higher rate than people without diabetes. Higher cholesterol makes having a heart attack more likely. People with diabetes should control their cholesterol to lower their risk of heart attack. Cholesterol measurements. Most often, cholesterol is measured every year using a fasting blood sugar when you fast for 8 to 12 hours. This includes total cholesterol, HDL, high density cholesterol, LDL, low density cholesterol, and triglycerides. Goals for cholesterol patients. Total cholesterol should be less than 200 milligrams per deciliter, and this is a good level. 200 to 239 milligrams per deciliter is borderline high, and 240 milligrams per deciliter is a high level for total cholesterol. Cholesterol numbers for LDL and HDL. LDL and HDL numbers can have a predictive factor in persons who are more likely to have a heart attack. People with HDL less than 60 milligrams per deciliter are more likely to have a heart attack. People with LDL 70 to 100 milligrams per deciliter are less likely to have a heart attack. Cholesterol goals for general population for those without diabetes. LDL less than 100 milligrams per deciliter, HDL greater than 50 milligrams per deciliter in men, HDL greater than 60 milligrams per deciliter in women, and triglycerides less than 150 milligrams per deciliter. Diabetics at high risk for coronary vascular disease ages 40 to 75 years. LDL greater than 70 milligrams per deciliter is a risk for coronary vascular disease for diabetics. Statin therapy is recommended if not contraindicated. Ask your healthcare provider for your specific health needs. Some people cannot tolerate statin therapy and other treatment is recommended. LDL goals for diabetics. In persons with diabetes, people who are less than 40 years of age or greater than 70 years of age. People with diabetes, the LDL goal is 70 milligrams per deciliter or less. These goals are from the NCEP guidelines. You and your healthcare provider will determine your own goals. Cholesterol treatment as per ACC/AHA 2013 guidelines for heart failure or hemodialysis. No recommendations regarding initiation or discontinuation of statins in patients with New York Heart Failure Association class 2 through 4 ischemic systolic heart failure. Ischemic means without oxygen, or patients on hemodialysis. You and your healthcare provider will determine your own goals as per patient needs. Major risk factors for heart disease: cigarette smoking, hypertension, blood pressure 140/90 millimeters of mercury, or on antihypertensive medications. Low HDL cholesterol is less than 40 milligrams per deciliter and is a major risk factor for heart disease. Family history of premature coronary heart disease in male first-degree relative less than 55 years. This is according to NCEP guidelines and not Joslin Diabetes Guidelines or JNC 8 guidelines. JNC 8 guidelines, hypertension of 150/90 is recommended for not having falls. But according to NCEP guidelines, hypertension of 140/90 or on an antihypertensive medication is a major risk factor for heart disease. Coronary heart disease in a female first-degree relative less than 65 years of age. Age in men 45 years of age, women 55 years of age. Coronary heart disease risk factors of LDL goals less than 100 milligrams per deciliter. Multiple 2 risk factors of LDL goals less than 30 milligrams per deciliter, or 0 to 1 risk factors of LDL goals less than 160 milligrams per deciliter. Cardiovascular risk calculator can be found at http://www.cvriskcalculator.com. Exercise for diabetes and heart health. Exercise increases HDLs or good cholesterol and decreases LDLs or bad cholesterol. It also improves cardiovascular health and exercise tolerance. Decreased chances of having a heart attack. Lifestyle modifications for diabetics and people with high cholesterol. Micronutrient, total fat, percentage of daily calories should be no more than 27%. Saturated fat should be no more than 6%. Protein should be 18%, and carbohydrate should be 55%. Lifestyle modifications for diabetes and people with high cholesterol. Cholesterol should be 150 milligrams per day. Sodium should be 2,300 milligrams per day for most people, and those with heart failure should be 1,500 milligrams per day. Potassium should be 4,700 milligrams per day. Calcium should be 1,250 milligrams per day. Magnesium should be 500 milligrams per day, and fiber should be 30 grams per day. Exercise for diabetes and heart health. You must ask your healthcare professional about exercise programs and what exercises you can do safely. Diabetics have an increased risk of heart disease and other illnesses, which may limit exercise. Exercise for diabetes and health. Most exercise programs include 30 minutes most days with no more than 48 hours in between workouts. Exercise in diabetes for heart health. If you are unable to exercise for 30 minutes a day, you can build up to 10 minutes each session 3 times a day. Try to incorporate small behavior changes such as walking stairs instead of using elevators. Summary: if your hemoglobin A1C is high, your blood is thicker, and there is an increased incidence of heart disease, kidney disease, limb disease, eye disease, brain disease, stroke, and death. Systolic blood pressure is a force exerted on the blood vessels when the heart squeezes, and diastolic blood pressure is a force exerted when the heart relaxes. According to JNC 8, those people who have diabetes and no kidney disease, blood pressure goals should be 150/90 millimeters of mercury to prevent falls. The target LDL cholesterol for patients with diabetes is 70 milligrams per deciliter to prevent heart attacks. If a person has a heart failure or is a cardiac patient and the patient becomes hypoglycemic, they can have a heart attack. If a person has high blood sugar day after day, most days it will clog their arteries. If you have low blood sugar, you are more likely to have sudden death or arrhythmias. Common signs of hypoglycemia are confusion, hunger, lightheadedness, shakiness, sweatiness, drowsiness, dizziness, sleepiness, palpitations, headache, anxiety, tremor, and blurred vision. Protein can be found in the urine, which can indicate kidney disease. Many urine strips that check for ketones also check for protein found. This should be followed up by a specialist. If hemoglobin A1C and cholesterol levels are maintained at a suggested level, your chronic condition is you have less chance of heart attack, loss of limb, eyesight, and kidney failure. References. You could look at the slides and you could read my references. Thank you for your time.